looks just like a mouth swab that you would use on somebody that's let's say they just had surgery and their mouth is really dry, but they just need to wet their mouth, okay? So you could use a swab like this, and it's an oral swab, and you would just, you know, wet it with the liquid that's in here, or wet it with water, and they would just wet their mouth with it. It's just a sponge, okay? It's a sponge. Well, they made these that the same kind of sponge, the same kind of effect. But you can literally put it on the suction itself, okay, like this, okay? So you'll see there's a hole. I don't know, maybe I got too close. Go this way with it. There's a hole here, okay? And that is, if the suction is going, you could do this, cover that hole, and so this little hole inside the sponge would suck the liquid that's in that area up through here, and into the suction container, okay, by covering this hole. You uncover it, the suction stops. You cover it, the suction starts up again. Okay, so this is what we would use for brushing the teeth of somebody that is unconscious, okay? You would wet it with a water, okay, and put it in their mouth. You would perform the oral care. If you feel there's getting too much liquid in there, just suck some of that out, okay? You don't want to be holding it and washing and brushing and holding this, because you're sucking the air right out of your patient. You don't want to do that, okay? So you only cover that when you want to suck out the fluid, okay? So wash, make sure you get the teeth, the gums, the roof of the mouth, the tongue, the cheeks, get all of that, okay? All right? So that's a swab that you would use, okay? We'll go over all this in a minute because I don't have gloves on or anything. I'm just showing you the equipment that you could use, okay? So this is connected to the yank car, right? The suction's connected to the yank car, okay? You could have a chucks that the yank car is in, trying to keep that clean, okay? You could have a toothette like this, so there's all different kinds, okay? All right, so what you're gonna do is you're gonna gather your supplies and you're gonna perform wipes up, okay? You're gonna position your client in a side-lying position with the head of the bed lowered, if they could do that. If not, you're gonna have them in a Fowler position. What's a Fowler position? It's a head up, sitting position, okay? So we're gonna bring the height of the bed to my working level to save my back, right? And then we're going to bring the head of the bed up, okay? We bring the head of the bed up to what is comfortable for the patient, or not contraindicated, or that wouldn't be debilitating or bad for the patient, okay? So then we're gonna put our towel down because we wanna try to keep everything as clean as possible, right? Okay, we're gonna we're gonna suction out any material, secretions that may be in the mouth to begin with, okay? If you're using the swabs, you would just get the swab out, wet it, okay, and proceed to brush the teeth, the whole mouth area, and you're going to be assessing it, okay? You may have to have a piece of gauze and pull out the tongue and take a look under the tongue and on the tongue to see if there's any sores, okay? So you're brushing it, okay? If they're able to have a drink of water and swish it and then spit it out, okay, they could do that, and you could wipe their mouth, okay? If they're unable to do all of that, that's when you use those special, the special swabs, okay? And you want to take and put them onto the suction. After getting them wet, get them on the suction, provide the care, and suction with this, okay? So you're doing the care, and you say, oh, it needs to be suction, just suction a little bit. Again, you're looking for mouth sores or whatever, okay? All right? At this point, you don't use water on your patient, right? Okay. So you've done all that. You can lubricate the lips with some water-soluble moisturizer. Do not ever use Vaseline, okay? Petroleum-based, because if they're on oxygen, oil and water do not mix, okay? It's part of the triangle for fire, and we don't want that to happen. So make sure that it's a water-soluble moisturizer, okay? You would clean up all your supplies, you would discard your gloves, and you would perform hand hygiene. And that is the skill 2.3 and 2.4, okay? Thanks.